Here's our keynote speaker, Darlington. Darlington is a PhD candidate in petroleum engineering working at the University of Calgary, and he's been conducting research on drill string vibrations and more recently, directional drilling automation and control. So he's a little bit out of his normal element here, but I think he's put some really great work into this presentation. And Darlington's also been a ardent volunteer with Untapped Energy over the last year. And if you've come to any of our normal meetups, you might have tasted some of the wonderful Nigerian food that's been available, and it's coordinated largely through Darlington. So thank you for that. So take it away, Darlington.
Hello, everyone. My name is Darlington, and thank you, Tim and Mark, for this opportunity to share my studies of data science and coronavirus with the rest of the group. I'm a PhD candidate student petroleum engineering at the University of Calgary. My supervisor is Professor Roman Shaw. Before we go too far with the presentation, I want us to take a minute silence to just honor those who have lost their lives in this pandemic. All right, so if you felt the length of time that we had to wait there, then it gives you an understanding that some people have lost their lives and some families are going through pain. And that's why this is a very serious topic in my heart. And 1 month ago, my supervisor said, leave everything drilling and focus on the virus. And that's why we're here. A few topics I'll be talking about today. I'll give you some facts about coronavirus and then help you with the emerging technologies. And then we're going to analyze some COVID-19 data. I picked this data up today from the Alberta website, and then do some prediction using machine learning on MATLAB. And then I've also worked on an app with 2 experts, and we'll come up with something we call the disease risk analysis app. I'm going to introduce it to you and explain to you why we need the app, what the app will have done before the pandemic started, and what it will help us do now. So first, let's look at the facts about coronavirus. There are several controversies, and I'm not going to go into those controversies surrounding how the virus started. I'm not going to go into that. But as of December 30, 2019, there were clusters of cases in Wuhan, China. And from that point on, you all know the story. There was the first case in Canada at some point, the first case in the US, and now we have over 50,000 deaths in the US and over 4,000 cases in Alberta. So you can see that the number of cases has increased in a couple of months. The number of people who have died from the virus in Canada and the US all died in the year 2020. So in just that short time, so many people have lost their lives. And then we can look at some of the important facts about COVID-19 compared to MERS and SARS. And you can see that although the age range here shows you so this data is as of January 2020. The age range was 21 to 76, but last week in the US, a 5-year-old girl lost her life due to coronavirus. So you can see that the age range has even widened. But compared to MERS, we all know everything about MERS is complete. So it's between 14 and 94 and 1 and 91. One thing I can say is that for coronavirus, someone of the age of 99 survived the virus. So at least it gives you an idea that the deaths and the survival are varying in terms of age. And then the male to female sex ratio is 2.7 to 1. We have more male dying to the virus in China at the time of this data set. And there were 835 cases then, but now we know that it's over 2 million worldwide. And the mortality rates, which should give us some hope, is 2.9% for coronavirus, but the other ones you can see is 37% and 10%. But a fewer number of people who were affected. The total number of cases in MERS was 2,000 plus, and that for SARS is 8,000 plus. But now we are over 2 million worldwide coronavirus cases. And then, of course, we have healthcare workers dying as well. For MERS, the total percentage of healthcare workers who died, who were affected, were 9.8% and 23.1%. And that's because there's not enough technology to help the healthcare workers to save them from getting infected, because as they're showing care, they're also being put at a vulnerable position. Now, more facts about the virus. Yesterday, the CDC, the Center for Disease Control and Prevention of the US, came up with some new symptoms. But at the beginning, when it just started, the basic symptoms that were being detected were fever, dry cough, and diarrhea, and so many other symptoms. One thing to note here is that the ventilatory support, that's the need for a ventilator, is 9.8% for coronavirus, but 80% for MERS and 14 to 20% for SARS. 9.8% means that you have, out of all the cases, 9.8% of the victims will end up in the ICU, that's intensive care units. So that's one key factor to take from that. And now let's look at the emerging technologies. So one of the important things to do is detect fever. You have to try to detect the symptoms so that you can know who to isolate. Most of these things were very useful before testing started, proper testing started. And then you can use this to test a wide range of people. So Cognizant Health launched the Health Cam, which will be able to detect fever. It uses the features of a high resolution screen, optical camera, and an integrated thermal camera. And so as you can see here, it detected that this guy at the back has a high fever and he's a suspect, not necessarily infected, but a suspect of coronavirus. So in such a scenario, they can isolate such people and do a proper testing and know if he has the virus or not. And then it can detect fever up to 16 feet away near the eyes. And so the other technology in vogue is the digital QR code, which is the quick response code. The Chinese government has used this to put a kind of code on every individual to know who has the virus and who doesn't have the virus, and what's your pedestrian restriction. And so you can see this guy from CNN has a green code, which means that he's free to move around and do whatever he likes. And so the way they delivered it is to use Alibaba's app called Alipay. Alipay is the biggest online payment system, bigger than PayPal, and also Tencent's WeChat. And these are two popular apps in China, and these apps are in the smartphone of most Chinese. And then they can download it and answer a few questions. And when they answer these questions, they're going to get either of these three codes. So if you have a green code, that means you're free to move about in public. If you have a yellow code, then you isolate for 7 days, meaning that you have some symptoms of the virus, but not necessarily that you have the virus. But after 7 days, if the symptoms grow worse, you definitely have it and you should further isolate. And if it goes worse than that, then you have to go to the hospital for treatment. And then red code means you have to isolate for 14 days. These are more severe symptoms, and then these symptoms eventually would either go down or the person would need intensive care or hospitalization within a couple of days. But within 14 days, it is expected that the symptoms will either mature or die away. And then in order to use the digital QR code, people will sign up with their national identity number or passport and their phone number. Then they will ask them questions about their travel history. If you have been to Wuhan in the past 14 days, and then they will also ask them questions. Do you have fever, fatigue, dry cough, stuffy nose, runny nose, and throat ache or diarrhea? These were the questions that were asked. And then the algorithm will now assign one of the QR codes to the individual. Now, there were some problems. People said they were given red code for the wrong reason. Like, why should I get a red code? I just have a seasonal stuffy nose or fatigue, and I'm getting a red code. And one other problem was that they don't have like what the previous presenter was saying, how better we have a centralized health system. They don't really have a centralized health system. So different governments have different ways of assigning their codes. And somebody in one city will have a red or a green, and in the other city they say the green is actually a yellow. And so there was a little bit of confusion there. And that's one of the problems with this solution. So other emerging technologies are disinfecting robots, smart helmets, which was worn by policemen, and they could detect high temperatures while moving around the public. And if they find out such a person who has high temperature, they can isolate and send for testing or give the necessary advisory. Thermal camera equipped drones. So these are drones that can go in the city and detect people who have high fever, high temperature, advanced facial recognition software. And then this is one other technology I want to show in this video. Because people in the hotels have to isolate, and they couldn't have the staff come give them food, there's also this robot that delivers food. All right, so you can see, I just wanted to see the first person who's going to take his food. This is something we can also use in the hospitals as well. All right, yeah, so. Okay. All right, so we'll move to the next slide. Now we're going to look into data set, analyzing COVID-19 data set. So the whole idea is to see how we can derive patterns in the data set. And based on these patterns, we can make predictions. And the importance of making prediction is to ensure that in terms of flattening the curve, if we can see the reason why it's going up and find a reason why the curve will come down, then those advisory can be given to the healthcare sector. And so what we're going to learn here is just basically finding this pattern and doing some prediction. So this is like motivating you to go do further work. So all I've done is just the basic prediction model using machine learning, and then you can do further work on your own. And so as you can see in the time here is 2:28 p.m. Earlier today, I downloaded this data set. So this is from the sources from alberta.ca. And this is the total number. This is the cases that we have reported in Canada, in Alberta today. And so there are a lot of issues with the data, and we'll go through that one after the other. First of all, you need to know that there's 4,698 observations. So each one is an observation in this case. And so when you look at it the first time, everything looks normal. But what could be the problem with the data before we can take it to MATLAB and do some machine learning? First thing is probable cases. So these are cases that people have symptoms of COVID-19, but they've either done a test or the test result is not out yet. So I have an issue with that, because if I want to say whatever I did was basically a COVID-19 issue, I rather would work with confirmed cases, right? So in terms of the case type, there is the probable and then there's the confirmed. Confirmed means the test has been carried out and it was positive. So if you're positive, you have the virus. And then the second point to note here is unknown. So in the whole data set, there are some information that are unknown, and that kind of affects the way the modeling will work. So I don't want to have such observations. I need to know the age so that my learning model works properly. And so I'm going to take out the data set that are probable, and I'll take out data set that are unknown. And then secondly, another point is active. Now you say, what's the problem with active? So you have in the case status, you have active, recovered, and died. Now, active are people who contracted the virus, but eventually will become what? Either recovered or died. So that means if I have 2 months data set, people who are active will eventually become recovered or they will die, unfortunately. So I really want to focus on recovered and died because those are the real classes I have here. Because the died person cannot become recovered. Although the recovered can die, but the recovered will not die from COVID-19, maybe something else, except the recovered becomes active again. But what is expected is that the recovered, the active person will either become recovered or he's going to die. And so I'm going to remove all the active cases and have only recovered and died, because those are the two splitting classes. And then something I noticed which changed the whole work for me. I'd done all my prediction and done all my MATLAB and machine learning modeling, but I now realize that the dates were not properly arranged. So you can see here, you have 9th of April, 2020, and then the next thing you have 25th of March. And so if you think that the numbering is according like this, it's wrong. So that date has to be properly arranged so that when I'm predicting the future, whatever I learned from is actually the past, okay? So those are the facts that were very important. And so the next thing is to import this data set into MATLAB using this code. You can see this is the name of the Excel spreadsheet, and then sheet 1, and I picked 3 to, so B to G, which is the date reported, and up to the case type. And then I started at the 0.3. That's why you have 3. And then 4698 is the total number of observations. And so and the next thing I did was to change this to a date time and then pick up all the other data points. So you have 2 for zone name, which is this, and then gender, age, case status, and case type. So now I told you earlier I need to remove the probable cases, the active cases, and this unknown here. And so that's the next thing I'm going to do. So all of this can be called data preprocessing. And so the next thing I'm doing is to remove the active cases. And so to do that, I'm going to isolate the active cases. So what I'm doing here, I'm saying, if the data set has an active case, give my signal size, which is just a variable, 1. And if that data set if the case status does not have active cases, give it a score of 0. And so with that the column that has case status has been divided into active and non-active. So non-active means recovered or died. And so after doing that, all this data set is just to ensure that the remaining columns or the remaining predictors all don't have active cases. So all of this now become the zone name, the gender name, the age group, the case status, the case type without active cases. So that's what I'm doing there. And then the next thing here is to remove probable cases. So the same principle, I am isolating the probable cases in the case type. And so what we're doing now is to put a score of 1 for case type that has probable case and 0 for case type that doesn't have. Now, when you look at what I'm picking up here, what I'm finding here in the data set, I'm finding the sign, the case type that does not have, that's what you can see, equals to 0. So this is the case type that does not have probable cases, because all I want is confirmed cases so that I know I'm dealing with COVID-19 for sure. And then now also, after doing that, I realized that it's only the zone name, because of course, you know, now from 4,900 and something data points, the data set is now reducing because I've removed all the rows that have active cases, all the rows that have I remove all the rows that have active cases. I remove all the rows that have probable case type. And now I'm also removing all the rows that have unknown in the zone name. So the other columns with unknown have automatically been removed because I've checked for it by finding the unique variables in the unique items in each of those columns. So now it's only zone name that has unknown values. And so I'm also in the same vein, I'm putting a value of 1 for all zone names with unknown, and a value of 0 for zone names without unknown. And then I'm also now going to pick all the variables that have no unknown in them based on the zone name. And that's what this code is doing here. And so yeah, so I just wanted to signify that zone name. And so now I've prepared my data set, but the only thing remaining is the fact that the time is not correctly arranged. And so I'm going to use this code and sort the rows based on the reported date. So what this does is that it arranges the date based on the earliest day that we had a case in our beta, or up to today. So that's what this code does here. And then now I have my data set. So my data set is a table of reported date numbers. So and what I'm doing here is just converting the date, because now you have month, year, and day, but I want to make it a single number. So this code gives me the date of each variable, of each observation based on 1980. So that's what this MATLAB does. So it counts from the number of, it gives a count from 1980 up to whenever these dates are. And so now my data set is a table of the reported date number, the zone name, the gender name, the age group, and case status. Now you wonder, why is case type not there? So now case type is no more there because all the case types are basically confirmed cases. So there's no variation in that. It's not going to help me in my machine learning model. So I take it out. And so, yeah, so that's the data set. Now, what's the goal of the training of the machine learning and prediction we want to do? So at the end of the day, I realized that from 4,000 data points, we now have 1,277 data points after doing all the data pre-processing. And so I want to train with 700 points. So now you need to understand. So a lot of machine learning is to predict the future. But for you to predict the future, you need to have features. So if I go back and show you, yeah, so when you look at this, if I was going to, so what my response variable is the case status. So if I'm going to predict the future and know what was recovered or died, who is recovered or died, I need to have all these other variables available for the future. But now I don't have anything. So, I mean, I wouldn't know the next person who have COVID-19, if he's going to be a male or a female, or if he's going to be between 40 to 49 years old, or if he's going to be from Calgary or Edmonton or North Zone. And so what I now did to help achieve the goal that we have here is to go back in time. So I'm saying, assuming I had between March 1st and April 1st, so I will go back to like the second week of March and make the first 2 weeks my training set, make my validation the third week, and then make my testing the fourth week. But I'm not going by week here, I'm just going by a number of points. Now, don't forget the points have been arranged according to timeline, the proper timeline. So point 1 is earlier than point 2 and earlier than point 700 and so forth. So what I'm doing here is taking the first 700 points as my training set and then validating with 300 points and then testing with 277 points. And so that's what I'm doing here, and this is the code for that. So this side of it is the rows, and this is the column. So these 2 dots, what it means is all the columns for the first up to the 700 rows are my training data set. Validation is all the columns from 701 to 1,000 points, right? And then my testing is 1,001 all the way to the end, which is 1,277. So you can see that we had 4,000 plus data set today, but after doing the data pre-processing is now 1,277. And then I've divided into training validation, and testing. So the aim basically is saying, I will train my machine learning model with the training set. I will validate what I've done with the validation set, and then I'll test it with the testing set. But also, I will update the model after validating and then redo. I will do the validation again. Okay. So now, prediction using machine learning model on MATLAB. And now the basic principle, I'm going to be using Naïve Bayesian classification. Basically, what this is saying, I'm using this model because the variables, the predictors are unrelated. And when they're unrelated, one of the methods to use is Naïve Bayesian, because the predictors are naive. And basically what it does is, this is the formula that is being used. So the maximum posterior probability is the selected class. So between recovered and died, every time the model goes to each observation, the maximum posterior probability will be selected as the predicted class. And so if you look at this, you can see this was the previous observation, and the maximum likelihood is on the posterior is chosen. But for the next data point, so this now becomes prior, and then this becomes the likely. So the likely that will be chosen will be the maximum here on the posterior formula. And so coming to that, one of the things I want, before I talk about the L train and the L val, the pred train is just saying predictor from the training data set. So all I'm doing here is just picking the first 4 columns of the training data set, and then I'm also picking the last one as my response variable. This last one is just saying recovered or died, and then the other ones are the age group, the gender, the zone name, and the time. That's all that you have here. And then I'm running my machine learning model here. So this fit C just means fit a classifier. NB is the Naïve Bayesian, and this is the function in MATLAB, and it will require two variables, which is the training data set. Both of them are good for the training. This becomes the model I will use to predict the classes of the validation and the testing data set. So what I'm doing with L train here is just calculating classification error. So that is how I will know if I'm perfect or if I've improved my model. So L train here just simply says what's the percentage of the training did I get wrong, right? So what we are doing here is, I have a data set with the 4 predictors, and I have the one response variable, which is recovered or died. So the model will go through the entire data set of the training data set, that's the 700 points, and determine what patterns are there, and then predict the classes, which is the responses. And so the loss will tell me how many of the predictions are wrong. And then I'm also going to pick up the validation data set, which is picking the first 4 columns of the validation data set. And the responses will be the fifth column of the validation data set. And then I want to know the losses based on this model that I've developed here. I want to know the losses when I try to predict the validation data set. So this is the losses for the training, and these are the losses for the validation. And so here, what I'm doing is I'm using an optimization model to update my machine learning model. So now I'm trying to improve my machine learning model I would want you to, these slides and codes will be sent to you. And then I wouldn't show the plot of this one because it's an animation, it's an animated 3D plot, very beautiful to look at. I want you to try it at home and run it and see how it works on your own chart. And so based on this new, so this is now a new model because I've updated it, I've optimized it, I've made it better. And then I'm going to calculate my loss for the training data set. Now it's a new loss and new validation. Now the expectation is that because I made the model better here, these two values will come down here. So meaning that I'm doing better prediction. Now, all I'm doing here, labels, is just saying, I'm just predicting I'm predicting the labels of the validation data set based on the training data. And then now we are going to plot a confusion matrix. What really this is just trying to show us how many we got right and how many we got wrong, and put it in a comparison with the original data set. That's just for the validation and for the training data set. And so we're going to plot two of them here. So one is just for the training data set and the other one is for the validation data set. And then I'm going to pick the training, sorry, let me, I'm going to pick the validation. So there's a little bit of error here, but the aim basically is to, oh yeah, so that slide is not supposed to be there. So I'm plotting a confusion matrix here. Now this is the posterior. Why I put this code is just to show you that anytime you have a maximum posterior, then a selection is made. And so we will predict the validation data set based on the model. Now this model is what was regenerated based on optimization. And so the labels would be the prediction of the fifth column for the validation data set. And then here I'm going to be comparing the labels that were predicted with what was originally placed there. So now this is how we understand if we're right or wrong. So imagine I have actual values and then predicted values. So these are true positive. So if my prediction, which is in this case is recovered and died, if it is recovered and it was correctly placed, then is a true positive. But if I wrongly positioned it, then it is false positive. The same thing here. If I wrongly position a negative, which is if I wrongly position a died, it is a false negative. And then if I correctly place it, it is a true negative. And so all these formulas here are just telling you all the different things that we can calculate from that data set. Now, after running it, this is what we got, and I'll try to interpret this. This is just for the validation and the training data set. So you can see the confusion matrix for the training data set. Now, in terms of, it's obvious I'm doing better with the recovered than the died. So so what you have diagonally are the correct variables. So I placed 12 correctly. 12 died correctly because the target is died, and then my output which is what I predicted, is 12, and it's just 1.7% correct. And then I also placed 654, 93% correct for the recovered. And then when you come to the validation data set, we got 93% correct in terms of what we predicted for the output and the died. Now you'll be asking, what about what wasn't correct? Now, if I wanted to improve the correctness, all I need to do is do my optimization to better the model again, and then the losses will come down. And when the losses come down, the model will predict better. And so you can see on your right here, the L train is 0.05, that's 5% loss. But the new one is 0.0486. And then for the validation, the L train is 5% here, and then 0.04, that's 4%. So you can see that there's a decrease in the losses from train to train new and val to val new, which is the new after the optimization. And so the next thing I want to do is try to see how I can compare the died and the recovered of the testing, and then the died and the recovered of the original, what actually happened. And so all I'm doing here is predicting the classes for the test, and then I'm going to calculate the cumulative recovered and cumulative died. All of this is just to show what the trend is over that time period when I'm testing. This is for predicted. And then I'm going to, over here, I'm going to call back the testing data set. I actually have the original, which is, I just call it status here. The O here just means original. So cumulative of the recovered, cumulative of the died. I'm using this loop to calculate them so that I can see a comparison with what I'm predicting and what I am testing. So I'm going to do a test, run a test here. This hold on just means that I want to put all of these plots in the same plot, in the same chart. And when you put in the legend, you just ensure that you follow the way you put the plot. So total recovered is for recovered predicted, and total original recovered, died predicted died, which is died P, and original died O. And here you have the plot. So based on this plot, you can see that there's a little bit of discrepancy between what I predicted and what the original data is, but it's trending almost the same way. So this blue line is for the predicted recovered. I am overstating the recovered, so there's still room for improvement. So if I go back and try to look at my optimization to optimize my model, I can bring this closer. And then same thing here. I am under predicting the deaths, which is a good thing, but we should be getting the same thing. Now you ask, what's the usefulness of this prediction? So when they're talking about lowering the curve, flattening the curve. So flattening the curve in this case means I want to increase my recovered and I want to reduce the died. So I can now bring other factors, if allowed, even patient information, and plug it into the model and see how it affects my prediction. So whenever I start seeing an increase in the recovered and decrease in the died, I want to know what that factor is. And that's another area of research. So that's the basic prediction model that I've given. And this is the machine learning aspect of this presentation. And so based on further studies, I've come to introduce to you a disease risk analysis app. And these are the two experts that I've consulted, Dr. Amara Noze, who is a family physician at the Sunridge Family Medicine Teaching Center, and my supervisor on the analytics side, Professor Roman Shaw, who is one of the professors at the University of Calgary. And so one of the alarming, and this is the motivation for building this app, is the fact that as of 2016, we had 13% seniors, and now by 2036, we're going to have 22% seniors. And so the number of seniors would increase in the next 20 years to 9%, which is by 9%, which is over 1 million Albertans. That means in every 5 person, 1 person will be a senior. And why am I bringing up seniors? Is because they're more vulnerable in this disease. But if you think you're escaped because you're below 30 or below 40 or below 50, in the next 20 years, most of us here who are listening to me will become seniors. So that's the reason why we must take this very seriously and try to solve the problem. And so what's the concept? Somebody is in pain and someone is very active in life. The question is, how do we find out if you're pandemic ready? Because there's a lot of guessing game going on. And I mean, look at the timeline between when a good testing was done. Initially, it was several days to get a result, and now we're getting like 15 minutes or almost immediately. But what do we have to do in this period to get ourselves ready in case you get contracted or to avoid being contracted by the virus. So that's what this app is. The app is basically to help the doctors and to help people, to help the government decide where to focus their resources. Because right now, some people die within a week, some people don't die, and we're wondering who is surviving and who is not surviving. How do we know who to test? Or so many people have died because of wrong information, and people have contracted the virus because they didn't know they were to isolate on time. So many things, so many variables have changed over time, and everyone is getting confused. Well, how do we bring everything into one place? So that's what this app is. Now, the app basically is going to review a patient's information and assign to this patient what your risk would be if you have the virus. Now, why is that information useful? That information is useful if we know for instance, right now, if we know who would definitely survive the virus based on his medical history and some details about his health, that means that we can use such people. I mean, we can focus vaccination trials on people like that. Because if we can inject someone with a virus and know the person is definitely going to survive the virus, then we can see how his immune system will fight the virus. And then eventually, after he's recovered from the virus, we can take the plasma from this person and inject in people who are weaker and give them a better immune system. This is what I heard from the medical doctors. This is not me talking as an engineer. So, but I've worked with Dr. Anoze and I've worked with my supervisor. We've come up with some algorithms that when you go through phase 1, phase 2, phase 3, phase 4, phase 5, phase 6, up to phase 9, it's actually 10 phases. When you answer those questions, we can on the spot tell you what your risk will be if you have the virus. And then we're going to test this in a very simple way. So this is John Doe. John Doe is a 60-year-old senior who weighs 55 kg with a height of 1.63 meters. He drinks alcohol a lot and occasionally smokes. He is into vaping. Now, some of you on the spot will think, yeah, he's 60-year-old, he's going to die quickly. But that's not true, because there are some factors about him and his lifestyle that could determine if he will definitely survive the virus or if he's a high-risk individual for this virus. And so assessing his lifestyle, there are several ways of assessing his lifestyle in those phases. I'm just giving you one that has to do with physical activities. Is he someone who works out a lot? Or is he someone who works in the environment? Or is he someone who just sits down in front of his computer all day? These are so many things that are considered in this app. For instance, do you like to work in your environment and go around and view your environment and work out your body? Or are you the type who just sleeps at home and does nothing and eats the breakfast, lunch, and dinner? What kind of lifestyle do you have? You know, this kind of lifestyle are inputs that we need in the app, and so many other important information that has to do with your immune system, your BMI, and so many other things. And all these factors put together will determine where you fall on the app. Now, for 4 different possible results for the same individual. So he might be on this chart where if he gets the virus, this is what's going to happen to him. He's just going to fall sick, but eventually recover. But such a person here, a little spike and he's dead. Now you can see the same John Doe. Something among those 10 phases made us know that if he gets the virus, he might just last a week. And then in this case, if he gets the virus, he's on the healthy side, but not doing too well. And this is where you don't want to be, where it's not really sure. But this guy here, these features of this same individual means that in a very short time, he's going to recover from the virus. Now, this 16 battles, which you're seeing here, are features and facts about John Doe that will be imputed into the app that will determine what are the possibilities for him if he gets the virus. So this is if he gets the virus. And then in this case, of course, you can see if this were his features, he's dead. If this were his features, he's going to live. Now, the need for the app then and now. So the idea is to do more with less. So then we could have predetermined high-risk individuals and isolate them early, whether they are essential workers or not. So one of the things that we did in the lockdown is to say essential workers go to work and non-essential workers go home and isolate. But there are a lot of essential workers based on this app who are high-risk individuals, and they're very vulnerable people. And when you leave them to go to work and they contract the virus, they will die. So I've seen stories of people who lost their parents within a week. A guy died in the same hospital he has worked for the past 18 years. So that means that he was a high-risk individual. He was going to work because the government said he's an essential worker, and he contracted the virus, and his graph is just like the other guy, spiking up to death, and he's gone. So, but it's nothing we can do now because it has already happened. We've already locked down. Some people are already out there. But what is the use of the app now? So we can determine low-risk individuals and allow them first out of isolation early, whether they are essential workers or not. So now we are thinking of reopening the economy. How do we achieve this? So the way we achieve this is based on that app. If you are below the sick line and you're tending towards the healthy path, such people can go back to work early. At least they can be the first set of people to go back to work. And then we can isolate those other people who are high-risk individuals. And for those who are going to definitely die if they get the virus, they have to wait till we have a vaccine. So these are the risk assessments that this app is going to do. But this, of course, is the initial prototype, a lot of need for improvement. And then what's the delivery? So this is how it is for Alberta. I don't know how it is if you're not in Alberta, but we have an Alberta Health, which is like the Minister of Health. And then there's a lot of funds that go into Alberta Health Services. And this is fund divided into hospitals, EMS, emergency medical services, and the physicians. And then one set of people that a lot of people don't know are the primary care networks, which are the PCNs, which comprise of nurses, doctors, and other people in the healthcare sector. So we are hoping that with the PCNs, who are the people who actually would reach people at home, or equivalent groups, we can reach the families and do testing. Now, why are we going to use the PCN? Why is it not going to be an app you can just download on your phone and then ask yourself the questions or answer the questions? Because of the value that you're giving to the app, we want it to be authentic because it's very important. So with the PCN, we are trained professionals who will understand the questions in the app. They will ask you the question, and they will ask you questions that will mean what the app is asking. Maybe not the same question, but something to help you give the truth out. And based on your medical history and the questions they ask, the app will be filled for each individual, and an authentic score will be generated. And so with that authentic score, we can now know who will be more likely to suffer more from the virus and who will suffer less from the virus. And so that's the entire delivery of the app. And that brings me to the end of my presentation.